Australia. First of all, can I just thank the people of South Australia for the great work that they've been doing, rolling up to our vaccination clinics, rolling up their sleeves and having that jab. And now they're going to be able to be experiencing some of the reward for the hard work of this state over the last 2 years. So we are now planning to lift some further restrictions from the 28th of December. That's the date that we believe that we will be at or about the 90% fully vaccinated 12 and over in South Australia. We are going to be giving some reward. As I said, number one is at the pub you'll be allowed to go along and stand up for a drink. You'll be able to dance, but only in a fully vaccinated environment. So there's a huge interest, I suppose, now in making sure that people get vaccinated in South Australia. The previous or the standard arrangements that exist at the moment of 75% density will remain in place, but you can stand up and you can drink and dance in pubs from the 28th of December, and so I know that that will be a huge relief to many people who have been looking forward to that. If it is a fully seated environment, that increases to 100% for fully vaccinated locations. So I know a lot of restaurants, theatres, cinemas will be absolutely delighted. So for seated events and seated only, it goes up to 100% for a fully vaccinated site, 75% with stand-up consumption, and of course dancing fully vaccinated. The current arrangements remain in place for unvaccinated or partially vaccinated sites. Can I also talk about outdoor events? So we're going to remove the caps on all home-based activities. We're also going to increase the cap for events, COVID management plan events, from 1,000 up to 3,000. So a huge relaxation there planned for the 28th of December. And as I said, we can only do this because of the great work of all people in South Australia. We also will be implementing a new regime with regards to nightclubs in South Australia. The good news there is that we will allow fully vaccinated nightclubs to operate at 50% capacity from the 28th of December. That's our plan. And we want to keep making sure that we get those vaccination numbers there, but I know this is going to be a big relief for a sector which has done it disproportionately hard for a long period of time. So the key issue is go and get vaccinated. Thank you to everybody that has. There is a reduction in restrictions which will take place from the 28th of December. That's our intention. Certainly at the moment we are seeing increasing numbers in South Australia. In fact, 64 cases overnight in South Australia. We're going to see those numbers climb. Don't forget, a lot of the work which was done previously was done on Delta. We know that the Omicron variant is far more transmissible. And so we are very clearly going to be watching this very, very closely. But the reality is, at this point in time, we're seeing far less severe symptoms from those people that are contracting the Omicron. Our major stat here, and the issue that we're focused on at the moment, is hospital admissions. To date, we've had our borders open for more than 3 weeks. We've had Omicron cases in South Australia, but only 3 admissions to hospital, no admission into ICU, no admission into a unit which has the ventilator. So the reality is we're very pleased with that. In fact, we only have 1 person in hospital at the moment, and they're in a stable condition. So we're absolutely pleased that we haven't seen an increase level of hospitalisation in South Australia. This is the key metric that we'll be watching going forward. As people know, we built a capacity, the equivalent of another 400 beds in South Australia in preparation for opening the borders. And to date, we've had just 3 admissions, only 1 in hospital at the moment. But we will see the rate of new infections in South Australia go up, just like we are seeing them go up right around the country. We're watching New South Wales in particular very closely at the moment, because they have had a very significant increase in transmissions, community transmissions of the Omicron cases there. But to date, there hasn't been that escalation in terms of their hospitalisation. So they are ahead of the game in terms of what we're experiencing here in South Australia. So we'll continue to monitor that very carefully. Just one final thing before I go to any questions, and that relates to the issue of quarantine for international arrivals. As you would have heard earlier this week, we went from 14 days down to 7, and from the 28th of December, it's our intention to reduce that down to 72 hours. So I'm now opening up for questions. Andrea.
So 72 hours, is that for all interstate arrivals or is that for international arrivals?
No, this is for international arrivals fully vaccinated. If you're not vaccinated, it's still 14 days in a Medi hotel.
How concerned are you about the risk, given we are seeing the Omicron variant rip through the UK?
Well, we're seeing it in fairly substantial numbers in Australia as well, and certainly we're not going to be removing the requirement for people to have a full PCR test within 72 hours of departure, and then another test on arrival here into South Australia. That is going to be with us, I think, for quite an extended period of time. We need to put these speed bumps in the way of Omicron coming into South Australia. Our borders have been open and we have had Omicron cases in South Australia for some weeks now, but most importantly, it's not overwhelming our health system. Just 3 admissions to our hospital, only 1 in hospital at the moment. That person's in a stable condition.
I'm sorry if you've already said this, but is the home gatherings cap, is that changing?
Home gatherings cap has been completely removed from the 28th, and I know this is going to be a huge relief to people who have really had to do some fairly extensive workarounds. It was really important in the early days of this disease, especially when we were in the elimination phase of the disease, when we didn't want to have a single case of community transmission, otherwise it could have potentially closed down our entire state. The reality is that we are now in the suppression stage. We're putting speed bumps in the way of Omicron, but because of the great work of the people of South Australia doing that work and having that vaccination, it means that we can start to relax the restrictions, but we're continuing to do it in a prudent and careful way, keeping restrictions in place that are going to stop that spread going through South Australia too quickly.
I mean, the restrictions on vaccinated, the differences between vaccinated and unvaccinated for indoor places, is that essentially a vaccine mandate? Just because those places, it's going to be impossible to have both types of clientele in at the same time and manage that?
Yeah, well, we're giving people choice in South Australia. Many people have already said that, look, my gym is 100% vaccinated, or my staff or my clients are vaccinated. They need to have a reward for that because it is going to be a lower level risk in those settings. And so what we've done here with this framework is to put in place a framework which is going to manage that risk. Now, when you have unvaccinated people, there is a higher risk. That is pretty logical to me, and so we're rewarding those venues, indoor venues, who are going to operate in a fully vaccinated way with reduced restrictions.
Was any consideration given to making the date before Christmas, given that there's probably not a huge variation in the vaccination rate between sort of 89 and 90%? Couldn't have just been done 3 days earlier?
Well, we put that in the court of the people of South Australia, and we gave them the challenge. We're not going to meet it by Christmas. We hope that we will meet it between Christmas and New Year, and I think this is going to be just a great relief to the people of our state.
You had initially promised that 90% we'd remove, make it quarantine-free travel. Why did you go 3 days for international?
For international, well, we're just looking at the situation that exists around the world at the moment with Omicron. We know that New South Wales and Victoria moved back from 0 days to 72. We'll continue to monitor it. It's quite possible we'll be able to remove it completely, but we've always taken a prudent approach here in South Australia. We will be, if you like, the second lowest in the country with 72 hours, and most of the other states are still at 14 days.
There are very long testing lines, particularly for those who come from interstate and don't have cars. Have you not put enough resources into testing here in South Australia?
Well, I still think that our wait times are commensurate with most around the country at the moment. I think we've been spoilt here in South Australia with very, very short lines for a long period of time. But this week we've seen some extraordinary testing days. I think earlier in the week we had more than 19,000. Again yesterday, more than 17,000. And those tests, yes, there have been some delays at some sites, but they've been getting processed very quickly. Those results turned around. And I'm very proud of the people that are working in assay pathology. But we have had a situation, I think, for a long period of time where there was virtually no wait and results coming back in 3 or 4 hours. This just hasn't been the experience anywhere else in the country, and we are experiencing a surge at the moment.
Premier, are there any kind of quotas for people travelling internationally, whether they are vaccinated or unvaccinated, or have those quotas been removed?
So those are set by the federal government, but from our perspective here in South Australia, we'll be talking to the feds. We obviously have a capacity constraint in terms of our hotel quarantine rooms in South Australia. So for people that are not fully vaccinated, we will definitely still have a quota.
You removed the isolation requirements for interstate arrivals, and that likely wiped out the test
So
caption?
just say it again, I can't quite hear.
The isolation requirements while waiting for a test for
Yes.
interstate arrivals. That likely wiped out the test captain yesterday, playing the Ashes series. Are you reviewing that at all?
No, I don't. I'm not trying to be difficult. I just can't follow the question.
So the rule that caused Pat Cummins to miss out on the test, essentially, which requires contacts to isolate, would you consider shifting that into line with interstate where you don't have to?
Well, I think this is a decision that was made by Cricket Australia. I mean, let's be very clear about it. They put their statement out before we'd actually conducted the interview with Pat. So, I mean, the issue is, I think that Cricket Australia probably formed the opinion that they didn't want to have a chance for the entire two teams to be deemed as close contacts and ruin the entire test series.
Are you saying that Pat Cummins could have played?
Sorry?
Are you saying that Pat Cummins could have played?
Well, I'm just saying, I don't think it was in anybody's interest to have a potential person that was infected playing Ashes, because it could potentially throw the entire series out. I mean, that was a decision that was made before we'd even we'd conducted the interview.
Going back to Harvey's original question, I think the point he was making was that the person at the restaurant was they had their test but hadn't got the result yet. So is there any consideration to make people isolate?
No, look, I think that, look, we're trying to manage risks here. We are at a different stage of this disease. Going back 2 or 3 months ago, look, we were belt and braces here in South Australia. We had, in terms of our TTIQ, rings around rings. And that's one of the reasons why we didn't have the extended lockdown that we saw in New South Wales, the ACT and Victoria. And that's something that I think we benefited from. We're the fastest growing economy in the entire country. In fact, yesterday showed that we created 10,000 jobs last month. That's what happens when you can manage COVID effectively. But we're at a different phase now. We're heading towards having 90% of our population 12 and over fully vaccinated in South Australia. We already have well more than 90% of our 12 and over population with a form of vaccination. This is world class. And so, of course, the risk diminishes, so we can prudently reduce those restrictions.
Even at fully vaccinated, sorry, Harvey, even at fully vaccinated, it's only 50% capacity, as you said, for nightclubs, but also for indoor fitness. At which point do we lift those capacity caps altogether? Look,
as I said, really pretty much for the last 3 weeks, we are still very concerned about Omicron. We're seeing a very significant increase in the infection rate in interstate, especially in New South Wales at the moment, and we still don't know that much about it. Now, I think what we do know is it's highly transmissible, far more transmissible than the Delta variant, or in fact any of the earlier variants of COVID-19. What we also know is it looks like there's a lower level of severity, but we're only a few weeks into this variant and we really need to get further information. Those environments that you're talking about where people are breathing out a lot, it's hard for them to wear masks, are at a higher risk than people that are sitting down, perhaps in a cinema or facing in the same direction. So what we've tried to do here is to look at the risk associated with all activities and, where possible, reduce that down.
Can I just ask you, masks seem to be staying in indoor public places and public transport. What's the health advice, or what's the thought process behind that?
So, look, we are convinced that we need to keep the mask mandate for all indoor public areas in place at the moment. We'll continue to look at it, but we know that this is a highly transmissible variant, and we know that this is a way of further protecting ourselves as we gather more information. But the crucial thing is that we are going to be able to prudently reduce some of the restrictions in South Australia now that we're getting more vaccinated.
Is it a bit asked to make businesses, I guess, enforce these vaccine rules? And what would be your advice to business owners who are trying to work out how to do that?
Well, we've tried to help as much as possible. I was at the Adelaide Convention Centre this morning. When you QR code check in, there you're asked to show that you're fully vaccinated. It's been a fully vaccinated site now for a couple of weeks. In the early days, yes, you're quite right. People saying, well, I haven't got that showing on my phone. I think the vast majority of people now do have it showing on their phone. And what we're doing now is offering choice to business owners in South Australia. They may choose to keep an unvaccinated status for their premises. That's fine. But there's a slightly different set of restrictions, and those restrictions are at a higher level, commensurate with the increased risk over those venues who say, all my staff, all my patrons are going to be fully vaccinated. Because we know in that environment, it significantly reduces the risk. We know that when you're fully vaccinated, you're far less likely to be able to transmit the disease and also less likely to contract the disease. And that's why we are still encouraging every single person in this state to get vaccinated. It's one of the reasons why at the moment here in South Australia we are considering whether we bring that booster forward even further than what Australia has announced. We've obviously gone from 6 months to 5 months. We're now considering in South Australia whether we would shorten that even further to provide that additional level of protection here in our state.
Can I just ask you, I think everyone is welcoming of all of these easing of restrictions, but what do you say to people that were expecting us to go even further? You know, there's still restrictions on businesses and nightclubs and indoor fitness. What do you say to those people that think, well, we're at 90%, we've done what you've asked us to do,
yes,
and yet it doesn't seem that you've fully rewarded the public for that choice? What do you say to those people?
Look, there are some people who just say we don't want any restrictions whatsoever going forward. They've been sort of very keen to express those positions to me for months and months, in fact years in South Australia. All I can say is we've listened to the experts, we've looked at the science and the evidence, we've kept South Australia safe, and that's meant our economy's been the strongest in the country, and we'll continue to listen to that evidence. And when you look at South Australia and our performance, I think you have to say we have done well, and will continue to listen to that science and that evidence into the future.
So, Premier, the Transition Committee ends as of the 28th of December, is that right? And are you now in charge when it comes to lifting restrictions from that point? And when do we go to no restrictions at all?
Yeah, well, look, you know, we don't have a crystal ball. The reality is we are very concerned about Omicron, but we're less concerned now than probably we were 3 weeks ago because we are learning more. It is highly transmissible. We're not sure about the vaccine efficacy, and we're still weeks away from understanding that. But now with 3 or 4 weeks of cases in New South Wales, we can see that there hasn't been a massive initial escalation in hospitalisation. And certainly from South Australia's perspective, 3.5 weeks with our state borders open, only 3 admissions to hospital, only 1 person in a stable condition in the hospital system in South Australia at the moment. Now, we've massively built up our capacity in South Australia. That was the responsibility of the COVID Ready Committee, which I chair. We created the equivalent of 400 additional beds in South Australia, and to date, only 1 of them is currently being utilised.
What will be the rule for COVID cases and for close contacts of COVID cases from 90%?
So we are constantly looking at what we call TTIQ, test, trace, isolate and quarantine. And you would have seen over the last 3.5 weeks, we have been gradually ratcheting down our response. We wanted to put those speed bumps in the way of Omicron getting hold. We certainly didn't want to have a massive Omicron lockdown in South Australia in the lead up to Christmas. Now, we've ruled that out. We've ruled out statewide lockdowns going forward, but we do still need to keep some test, trace, isolate and quarantine protocols in place. At the moment, we are optimising our performance, but over time, like in other states, they move to partial TTIQ. Now, they can do that in other states because they still have a higher vaccination rate for us in South Australia, and as we get to 90% and then beyond 90%, you'll see that we'll be further ratcheting back that TTIQ.
So will it be the same rules we have now? So if you're a close contact, 7 days, if you're fully vaccinated, and 14 if you're unvaccinated?
Yes, correct.
Premier, how many cases of unlinked community transmission have we had since the borders reopened?
Well, it's hard to say on a daily basis because some days we will say, look, there are 6 that we're still investigating, and 3 days later we can actually link them up. So I don't have an exact number for you, but often we chase down those chains of transmission and can actually link them up. But I do emphasise this isn't as crucial to us now as it was 3 or 4 weeks ago. So 3 or 4 weeks ago, we had an elimination strategy. We didn't want any community transmission. So a single infection in South Australia, we really wanted to know everywhere that person had been so that we could go and find people who could have potentially come into contact with that person during their highly infectious stage and put them into quarantine and then their close contacts into quarantine. That's not the arrangement at all anymore. We are going to see the numbers in South Australia continue to climb. Our key metric is looking at the hospitalisation, and to date we've had just 3 admissions in 3.5 weeks in South Australia, and this doesn't trouble us at all because we've been able to get ahead of the game and create the equivalent of 400 beds in the South Australian system ahead of lifting those borders. Now, we will continue to see those numbers climb, but people shouldn't be concerned about that. What we will be doing is constantly keeping you updated about hospital admissions.
Premier, can I just reiterate, ask another question to do with resourcing? We have seen long lines, particularly for walk-in clinics in the heat. There's also been concerns about the contact tracing and the fact that people have not been identified more than a week later. Are you happy with the resourcing of SA Health CDCB as well as testing and SA pathology?
Yeah, look, absolutely. We've very significantly increased our SA pathology team by about 100 people in the lead up to opening our state borders. And yes, there have been some people who have experienced some delays over the last couple of days with a massive increase. We were a few weeks ago sitting at 3,000 tests per day. This week we had a day of 19,000 tests. But I'm absolutely convinced that we've been getting through those as quickly as possible. I think we'll reach a new equilibrium in the coming days. The key advance that we have made is that people can book in. They can book in at Ridgehaven, they can book in at Victoria Park, and they can get into a streamlined access to that PCR test. So just encouraging people to make full use of that booking in facility. You also asked the question about the resources within the Communicable Diseases Control Branch. These are those fabulous detectives who do all of that work with the contact tracing. Yes, we have got an expanded capacity there, but we're also going to a lower level requirement to chase down every single line of transmission. That was our case a few months ago. The Doherty Institute modelling was done on two types of TTIQ, one being optimal, the other one being partial. We are in that transition phase at the moment.
From tomorrow, if you're identified as a close contact of a positive case and you're fully vaccinated, Christmas is in isolation. Do you think people perhaps might not check in or might?
Yeah, I've had that put to me a lot, but the reality is the QR code check-in and the testing are both at very, very high levels at the moment. I got told nobody would go and have a PCR test. We've had record testing. Look, I back the people of South Australia who have done an outstanding job over the last 2 years. I back them to continue doing that fantastic job. By working together, we've actually delivered, I think, the safest state and the safest country on earth. And of course, our economy is extraordinarily strong at the moment. You would have seen those employment figures coming out yesterday. We've got the second lowest unemployment rate in the entire nation, 10,000 jobs created in South Australia, a further surge in the participation rate in South Australia, and we remain the fastest growing state in the country because we've done well in terms of COVID. We'll continue to do well in terms of COVID management, and that means maximising employment in our state.
Can I just ask you, the date, 28th of December,
yes.
Was everyone on board with that date, or
yes.
was there had to be a captain's call from either yourself or the Commissioner in terms of overruling health advice?
No, look, like we did last time, we chose a date. A model will tell you a date. Last time it told us a certain date. It was out by, I think, about 18 hours or... no, it was out by about 30 hours, that's right. It was out by about 30 hours. Look, really, that type of movement is not critical whatsoever. We know that people are busy at this time of the year. We're encouraging them to go off and get that second dose. We've already sailed past that 90% for 12 and over people having at least the first shot, and there's a very, very high correlation between first shot and second shot in South Australia. So I think we're now providing the people of South Australia with an added motivation to go and get vaccinated, because there is going to be a differentiation between vaccinated indoor settings and unvaccinated indoor settings, and people may be precluded from doing what they want to if they're not vaccinated. So my strong advice to people is to go out and have that vaccination. It'll be protecting yourself and your family, your work colleagues, and it will give you greater freedom to do exactly and precisely what you want to do.
As a follow-up, apologies, just to be clear, everyone was on board with December
yes.
28,
yes.
right up until the decision was made?
Yes.
How many of today's 64 cases are the Omicron variant, and how many, if any, are aged care residents?
Well, I don't have that information, but I'm happy to pass over now to Professor Spurrier if you'd like to ask those questions. Yep. Okay, thank you very much.
Good morning, and I'll just give a quick update on where the cases are up to. Now, we would normally be reporting our cases a little bit later, so I've got very scant details, but we have got 64 new cases today, so quite a jump from what we've had over the last couple of days. 49 of them are locally acquired, 3 from overseas, and we've still got 12 under investigation. There's 167 active cases in South Australia. So maybe just a couple of words on our TTIQ and just to follow on from what the Premier's talked about. So certainly I think we have been described in Australia, for South Australia, as having extreme TTIQ, and that was back in the days when we had an elimination strategy. So our team has had to readjust their focus, and we are now doing what we call optimal TTIQ. But as we get more cases in the state, we cannot continue to do that level of optimal TTIQ, and that is taken account of for in the modelling that was done, and that once we get to around about 30-35 cases a day, we'll start to pivot across to what we call a partial or a more realistic TTIQ, which can cope with that number of cases. So a couple of the things that we do as we pivot, we start to use more automations. So people who are cases will now be getting an SMS message to tell them that they have indeed got COVID, and also instead of having a very long detailed interview with the case, we have shortened our interview process and are using some online surveys as well. And what we're trying to do is, because we're here to save lives, to be perfectly blunt, we're here to save lives, and so what we're focusing on is any high risk occupation, and that might be somebody who works in aged care, somebody that works in an abattoir, somebody that works in our hospitals, particularly people who are not vaccinated. We'll be prioritising those people as well. And so it's a different focus. It's not trying to get hold of everybody as quickly as we have done in the past, because that is not possible. But what we will be doing is building in the automations that I've described. So it is a different way of doing things. So you asked a question, I think, Andrea, about how many cases have we got in aged care. We were quite concerned a couple of days ago, and we had teams really focus on this particular area because we had a doctor and a physio who were positive cases, and they'd been to quite a number of aged care facilities. So we had a lot of testing done, and the team have not told me that they've picked up any positive tests as yet, and we work hand in hand with the Commonwealth to deal with those sorts of situations. And the other area of concern for us was obviously the wastewater testing in Indulkna. So we had resources go up and do extensive testing in the APY lands, and again, those have returned negative tests, which is very good and very reassuring. So, of course, we look at our whole population, but when we're here to save lives, it's very important that we use our contact tracing team and the TTIQ to really focus on the most vulnerable in our community. So happy to take any further questions.
How many are the Omicron variant of the 64 cases?
So perhaps if I just digress back, my understanding is that we have 4 cases, but we have we need to do the whole genome sequencing for all cases to see if they're Omicron or Delta. Now, a quick way of doing that is a screening test looking for an S gene dropout, and New South Wales and Victoria are able to do that testing. We have got our labs set up to do that here in SA, but we need to wait for the primers, and these are parts of the chemical reaction that, and my understanding from SA pathology is that we're waiting for those to come from overseas. So at the moment, we cannot do a quick surveillance of all of our cases to look for S gene dropout. So on the basis of that, I've asked SA pathology in terms of their whole genome sequencing, and we can do 50 of those per week, and we're a small state, we don't have as many people, and that's what we can do. I've asked SA pathology to start to do a random sample of all of our cases, so not to start at the beginning and do the ones that came in on day X and then move through. I would like a random sample, so again, trying to get a sense of how much Omicron we've got now in our state.
Professor, can I just ask you, the cases, do you get a sort of a sense of how sick these people are? Like, what are their symptoms? Are we talking about really bad, like it was with Delta, or are they mild symptoms? Can you sort of
Yeah, so with this sort of numbers, I obviously can't keep track of every single person, but I certainly get the result come through, and often it does say on the form if somebody's symptomatic or not. So we've certainly had people that have had really significant symptoms, so headaches, sore throat, really feeling quite flat, sore muscles, aches and pains and such like. So not the sort of thing that anybody would really wish upon themselves. But on the other hand, we do have quite a number of people who have not had symptoms at all. The real way of looking at that is what impact it has had on our healthcare system. We're looking very closely at admissions to hospital, but we also have been transferring people into our health hotel if they need further monitoring and need more monitoring, and we can get the numbers of those people. But just to also say, because we're at the beginning of this and we want to do as much optimal TTIQ as possible, we have been, when people have a family situation and perhaps the one person in the family is a case and they can't separate in the household, we have been giving the option for that person to come into one of our health hotels, just so that the rest of the family has a lesser chance of catching COVID. But as time goes on, we won't be able to do that, and it's going to be up to families to work out actually how they can manage that isolation themselves.
Professor, why are interstate and international arrivals treated so differently? 3 days for international arrivals and none just to get a test, you come interstate. Isn't the virus the virus?
Yeah, it's a really good point, Harvey. So we obviously were keen to open our domestic borders, but we're watching very closely the epidemiology and the numbers in both Victoria and particularly New South Wales. And when I looked at the percentage of our cases a day or so ago, we had 10% of our caseload was from international arrivals and 30% was from interstate arrivals. So we're certainly getting more of a disease burden coming from interstate at the moment, and that's why as we move forward we will be altering that requirement for international travel. We are all very concerned about Omicron. It is much more transmissible. The case numbers are going up in New South Wales. Not to contradict the Premier at all, but we are learning more about this particular variant, and it does have immune escape, which means that our vaccines are in the 2 doses likely to be not as effective as they were for Delta, and this is one of the reasons we're actively looking at this at AHPPC in terms of really pushing that 3rd dose. I've had my 3rd dose. As soon as I heard that you could have a dose at 5 months, I was on the phone to my mother and made sure she got into Wavell and got her 3rd dose. So if I can give any message to people in South Australia, if you are due your 3rd dose, it's available for you, it's free, please go and get it. And as the Premier suggested, we are going to look at whether we can drop that timing any further, because really for Omicron, unfortunately, the face masks are here to stay a bit longer, but also we're looking very closely at the effect of vaccination.
So once we get to 90% double dose, is there still a chance that border rules might come back in if you're really concerned about those interstate, New South Wales and Victoria?
Look, I think we'd be very keen to not have any lockdowns and lockouts as we go forward, and because everyone has understood that vaccination is so important, but at no point has any of the modelling shown that vaccination can do it alone. There are still things that we will need to continue. One of them is the contact tracing and the testing. One of them is trying to keep a distance and keep up that personal hygiene, wearing masks to protect yourselves and others. And unfortunately, with Omicron, as the pandemic has shown, we get thrown these curveballs. If we were back with the old Wuhan garden variety, which I really love now, and we had our current vaccines, we would have been over this. But unfortunately, we got Delta, and Delta was okay too, because the vaccines were doing what they needed to do, and it certainly reduced hospitalisation and severe infection. And now there is this uncertainty around the Omicron variant, and whilst we are so pleased with South Australians getting on and getting vaccinated, we're absolutely stoked at these results and very happy to support lifting restrictions further. People who know me, I like dancing as well, you know, really good to see this. But on the other hand, we can't put our heads in the sand. We have to be looking at what's going on around us internationally and interstate and take that into account as we move forward.
Was there any thought of dropping the 7 days quarantine when we got to 90%, and if not, why not?
Yeah, so this is the question around close contacts, I think, and what we would do with quarantine. What the vaccines don't do is they don't change the incubation period. They reduce your risk of getting infected, and they reduce your risk of transmitting it onto other people. The extent of that with Omicron, we don't know yet. So at the moment, we are still going to be going with our 7 days quarantine for people who have been vaccinated if they're a close contact, and 14 obviously for unvaccinated. But as we move through in time, we'll be looking at our definitions of close contacts and hoping that we can make some adjustment with that.
64 is the highest daily number of cases we've had since the start of the pandemic.
Yes.
How concerning is this? Are you worried about this potential spread from here, especially when we've welcomed so many interstate visitors for the Ashes?
Yes, I was thinking through this morning, and I get these cases coming through in real time, so it's quite obvious to me that we're getting more cases without even getting the total number. I do think it's reflecting what's happening in New South Wales and Victoria with increasing case numbers. But at the end of the day, our sights are on what is impacting our healthcare system and how sick are people getting. So we'll continue to closely monitor that. We have a really strong relationship with the Doherty network across Australia, and particularly our own modellers here in South Australia, Adelaide University. They have spent some nights up, half the night, doing some additional modelling for us this week. As we get our numbers, they will be putting that into our model and trying to make adjustments for Omicron as well, so that we can provide from a health perspective the best evidence and the best advice to the Premier and to the Police Commissioner.
Professor, can I just ask you, please, the 28th of December date, was that in line with your health advice, and is all of these easing of restrictions also in line with your health advice, or did you have a differing opinion on any of it?
Look, we work very closely as a state, and I think that's what's held us in good stead. It's difficult to predict when you're going to get to a double dose vaccination rate, but because we've got already people who have had their first vaccination, we can at least make a reasonable prediction of when we'll get to that double dose. It may be a couple of days later, but as the Premier said, half a percentage here nor there will make a huge difference. When I look at the vaccination rates, what I'm looking at is where is the geographic distribution? Are there still some suburbs that are lagging? Are there some age groups that are behind? And the 16 to 30-year-olds, I really like to see those rates increasing. So if that happens to be you, and you've heard the press conference today about where you may be able to go in the future, I'm hoping that you'll listen. Don't be hesitant about getting that vaccine. I've had 3 doses. I'm standing here very fighting fit. Please go and get that vaccination.
Did you support 28th of December?
It was a consensus decision, Andrew. When we look at this, and there's different ways of predicting what the date will be. There's different ways of doing it. But what we felt is it's good for South Australians to have at least a date in their heads. And what we want to do is use that as a real push to get vaccinated.
Professor, 2 questions if possible. One of them is, can you envision a future in which you need 3 doses to be fully vaccinated with the Omicron situation? And also for children who are under the age of 12 who are coming internationally, would they just need to do that 3 days of quarantine if their parents are vaccinated? Is that how the rules work?
Oh, the second one's a bit technical, so let me just go to the first one. There are a number of vaccines that require 3 doses, and hepatitis B, for example, I'm pretty sure you need 3 doses for that. So it's not unheard of to have a course requiring 3 doses of a vaccine. The tricky thing is with Omicron, because with an mRNA vaccine, and I think people understand that both Moderna and Pfizer are able to tweak, because it's of the technology, they're able to tweak it to suit this particular mutation, but that's some way off, whereas we have Omicron really here already in Australia. I think what we are mostly thinking as experts is that it is going to, and I'm talking about 3 doses rather than a booster now. So we're looking at that closely all the time at HPPC.
When do you expect the booster? John. When do you expect, or what dates are you sort of looking at to bring forward the booster shot, Professor?
So at the moment we are sticking with the Tagi's advice, which is the 5 months. But when you look at the data, and this is quoting from a Tagi, is that you get waning of immunity at around 20 weeks. Now 20 weeks is difficult for people to calculate, so we're looking at that from a more pragmatic point of view to see whether we should be looking at dropping it from the 5 months. But at any rate, there's still a large number of people in South Australia, even at the 5 months or 6 months, who haven't had that third dose. So I really want to urge those people to get in and get their booster or third dose now. I know that you've got Christmas coming up and you've got other things to do, but this is really strong message from me today to go and get that done.
Were there any cases at the cricket? Were any of these 64 cases from the cricket yesterday?
So these have just come out overnight, and so the thing our team does is start to do the interviews and pull the QR data, so I can't tell you at the moment. But to be perfectly frank, I would be very surprised if we have 0 cases at the cricket. I think we will have cases for people that have come from New South Wales or Victoria.
Professor, what day would you actually prefer for us to open up for all these restrictions if you didn't support initially 28 days? And I appreciate what you said about it being a consensus, but what date would you have liked to have seen for us to open up like this?
Oh, look, I'm just going to go back to my previous answer, Andrew. You have to draw a line in the sand. We know that we've got X percentage of people with the first dose of vaccines. We know that the vast majority of those will get their second dose. We've got the holiday period. You know, maybe people go, no, I don't want to be bothered because of Christmas, rah-rah. So it's very difficult to predict people's behaviour. But that's why I'm standing here today, giving the message that if you're due to get your dose, please go and get your dose.
Professor, you didn't quite answer the question before. I'll just ask again, sorry. So are you considering for vaccines we know, like Pfizer and AstraZeneca, that it's possible that 3 doses would be considered fully vaccinated?
Yeah, that's absolutely what's under consideration.
And then beyond that, what's the situation with children who are under 12? Are they allowed to enter the state and only do 3 days of isolation, or do they need to do that full 14 days?
Oh, look, can I take that one on notice? As I said, it's a bit technical, and I'll get back to you on that. But we're talking about children 5 to 12. Of course, we will have vaccination for those children in our state very soon. And if your parents watching this, you'll have the ability to have your child vaccinated very soon. And we're hoping again that we get as many children vaccinated in South Australia to before the school year goes back, to avoid those disruptions with schooling.
Professor, just with Pat
Cummins, the Premier indicated that it was Cricket Australia's decision to, I guess, put him into quarantine. Did they do the right thing? Would SA Health have ordered him into quarantine anyway?
So if you have a look at our website, it's got the exposure locations, and my understanding is that the Little Hunter restaurant is an exposure location. There was an infected case there, and anybody who was in that restaurant at certain times on that particular evening is considered a close contact. So Cricket Australia will have got that information and they would have made a determination, and I'm sure Mr Cummins would have seen that as well. And then there's a survey embedded, and they would have been able to go onto that survey, and then we would have been able to see that that person was a close contact. So there wasn't any particular additional things done because it happened to be Mr Cummins, our captain of the Australian cricket team. But certainly anybody that was inside dining at that particular time was a close contact.
So are your contact tracers coping with these influx of cases?
I had a really good chat to them this morning. They are used to drilling down and being 100% perfectionists, and so as we're moving forward, I needed to remind them that we have an eye on hospitalisations and we're here to prevent death, and so they needed to make sure that they were keeping their minds on that as well, and not getting too upset that they couldn't get onto everybody as quickly as possible. We're in a different environment now. We have transitioned to having the virus here, and we're all getting used to that, and that includes my wonderful team in the contact tracing team.
Cricket Australia says that Pat Cummins had an interaction with someone that lasted only a few minutes, and this is the person that tested positive. And we've seen previously that sometimes areas are listed as close contacts, but then that's kind of scrapped and they're just casual contacts. Do you think that could happen in this particular case? Would you expect for that restaurant?
Look, I can't, make any more detailed comments. The restaurant has been called out as a close contact site by my team, and therefore anybody who was in there at that time, indoors, not outdoors, but indoors during that time, will be a close contact. Now, we have to remember that both Delta and Omicron are transmitted by the air, so aerosol, the highly transmissible. Even if you have the virus come into your eyes, you can get infected. And so Mr Cummins was not being treated any differently to anybody else in that space.
Right. Any questions of the Minister or the Commissioner? Commissioner, could we please have a word? Impatiently waiting there for 45 minutes. Apologies. Can I just ask you, on vaccination and unvaccinated premises and whatever, how are you going to maintain compliance and check compliance?
Well, as the Premier said, this will be a choice that businesses make, venues make in relation to whether they want to be a fully vaccinated venue or choose to operate under the current arrangements that are in place now as an unvaccinated venue. We will expect those obligations to be managed by the different places that choose to be a vaccinated venue, but we'll be there to support them and also to provide advice as well as monitoring compliance at the same time. So we won't be everywhere. We can't be everywhere, obviously, but we will certainly be out there making sure people are doing the right thing and that they're doing their part to manage the risk of COVID-19 as it works its way through South Australia.
Are you anticipating heated discussions, I guess, from punters not being able to, unvaccinated punters being able to let into premises or whatever? What's your message to those?
I certainly think it's likely. I'd remind people that we're doing this as a community. Businesses are making choices so that they can remain viable and operate operate as effectively as possible in these, dynamic times. Different businesses place different obligations on their patrons already, and they have a responsibility to make sure the patrons behave in a certain way. This is one of those obligations as we move forward, but it is also a choice for different venue operators in terms of whether they want to be vaccinated or an unvaccinated venue.
What's been happening with QR-code check-ins over the past few days? Have they been dropping off over the past few days?
The last numbers I saw, Alan, were on Monday. There was a slight dip, but it's probably commensurate with the level of activity we saw within the community. There are a lot of anecdotal stories around about people not checking in, and I think we've all probably seen people walking straight past QR codes. By and large, most people are doing the right thing. We're still getting over 2 million check-ins on our peak days, so we're watching that closely. We haven't seen any signs that there's been a massive drop that would suggest people are walking away from their obligations. Once again, it is one of those things that we can all do to make sure that we're staying on top of this as a community. And to be quite frank, I think I'd rather know that I've been in an exposure site so I can monitor for symptoms and not inadvertently pass on COVID-19 to vulnerable relatives.
Will you be stunned if you don't see a number of hospitality venues come out before December 28th and mandate vaccination? Is this essentially mandatory vaccination by stealth because they'll be losing money if they don't?
No, it's a choice for business operators in terms of whether they want to be a vaccinated venue or not. It is entirely their choice, and we'll make provisions for their staff who may not yet be vaccinated. But it is a choice for individual places in terms of how they want to operate.
And many businesses we've spoken to say we don't want that choice. We don't have to decide and tell our customers. We want the government to do it like it's been done in most other states in the country. Why didn't you go full mandate it at this level for hospitality?
Well, there are a range of factors. Firstly, I take advice from Professor Spurrier, and she's done an excellent job in providing advice right through the course of the pandemic so far. And the other factor is that the Emergency Management Act only allows me to make directions that are essential for the well-being of the South Australian community, and at this point in time, that is not the threshold that's been met in relation to mandatory vaccinations for a wide range of different sort of activities in this state.
Would you advise, or do you think it's appropriate in that case for businesses to advertise if they are accepting vaccinated or not vaccinated people? That would be a logical thing to do.
Well, that would be a matter for individual places. Clearly, that may be an incentive for people to visit those facilities. It's a matter for individual businesses. But this is about giving businesses choice. We've taken away so much choice over the last nearly 2 years. We're trying to give back as much as possible and manage it in a sensible and responsible way at the same time. We're not through the pandemic yet. In fact, South Australia is stepping into a phase that we haven't experienced before. So we're trying to do it in a measured way, but at the same time enable businesses to operate as effectively as possible.
I understand the Crow's Foot Board and even Hargan's launched legal action as a result of exclusion from the game, and it specifically names you. Are you aware of that or the details? Do you believe the
I'm not aware of that, Alan. Haven't heard that.
It was in court this morning.
I've been busy this morning.
Commissioner, can I just ask you, I've asked the others this morning, was there a agreement on December 28, and did you have to overrule, did you have to go against health advice in any way, shape or form to form this roadmap?
I saw this one coming. No, as Professor Spurrier said, it was a consensus. We discussed as a team what the options were, and there was agreement that providing certainty to South Australia in relation to when we envisaged hitting 90%, that was something that needed to be done. It was, I think it served us very well when we hit 80%, that we gave people clarity and they could make plans. We're doing the same thing now, but it was an agreement amongst the transition committee, and we've moved forward from it. There was no dissenting voice in the final discussion, and there was no need for me to make a determination separate of any outcomes from that discussion.
And can I just ask, sorry, Harvey, you go.
I wanted to ask, does your role change at 90%?
No, it doesn't. I still remain as the state coordinator. We still have the major emergency declaration in place. I'm looking forward to the point where COVID becomes one of those things I talk about maybe every couple of days as opposed to every single hour of every single day.
Was there any discussions about potentially lifting caps or any of those types of restrictions for Christmas? And what do you say to those people that can only have 30 people at their home for Christmas, as opposed to 3 days later you can have however many people you want?
Well, I think whoever's cooking for Christmas Day will be grateful that we have a cap of 30 people. We have not discussed any concessions for Christmas Day. We have set our target of 90%. I think it was the Premier or Professor Spurrier said that put that in the hands of the South Australian community. If we'd hit our 90% target more quickly, then Christmas Day may have been a consideration. At some earlier stage, the 23rd of December was discussed as a possible date to hit 90%. Clearly, we're not making that date. So we have not considered any specific concessions for Christmas. It's all centred around 90%.
Commissioner, you talked about trying to move back government and people's lives a little bit after a busy few years. How do you feel about the idea that 3 doses will be necessary to be fully vaccinated? Can you imagine a bit more of a staggered approach where 2 doses also does something good for you and the one more can help a little bit, or do you think it's going to be black and white, only 3 doses means fully vaccinated?
That's a question for Professor Spurrier. I'll follow. I've had my 3rd dose or my booster, and I'd certainly be following the health advice in that regard.
Just coming to the near end, guys, if you've got any questions for the Minister as well, please.
All done?
Thank you. Just actually one sorry, Commissioner. In terms of the people that might be expecting more easing of restrictions as opposed to what's been put out here, which is everyone welcome, what is your message to those people that expected no restrictions when we got to 90%?
Well, I think this is a substantial relaxation of the restrictions we have in place in South Australia. It does give people choice. As I said, we're taking a measured and sensible approach to how we lift these restrictions. I think Professor Spurrier has made it abundantly clear that we are very concerned about Omicron. We don't know enough about it yet to make any solid predictions in terms of the impact on South Australia or the South Australian healthcare system. We need to know that we have the capacity to look after South Australians. We anticipate a wave of COVID coming through the community, and there will be a peak of that wave. Once we're past that peak, we can then start to look at how we can remove all of these other restrictions that we have in place when we know that it is no longer a threat to South Australia.
And no lockdowns or lockouts?
There are no lockdowns or lockouts on the horizon at this point in time, but everyone has to remember we're in a global pandemic. It keeps changing the rules on us and we have to adapt. Thank you.
And can I just make one final, very small announcement, and that was that today, of course, the free trade agreement with Australia and the United Kingdom was signed right here in Adelaide. This is a great deal for Australia, but in particular a great deal for South Australia. It wipes out $45 million worth of tariffs on Aussie wine, and of course we all know that the Brits love our wine from South Australia. It's going to be great for primary producers. We're very excited that it was signed right here in South Australia, and it's effective immediately.
Like 3 minutes. Wonderful, people. Wonderful, wonderful.
pass on